are just a million things that we can do in the mental health treatment world to help you. So, I mean, I think losing hope in a mental health treatment situation is, I mean, it's the last thing you should do. There's always something else that we can do to improve mental health symptoms. There's so many options. I was first exposed to the mental health field in nursing school. I didn't really know a whole lot about mental health before that. I always knew that I liked healthcare. I always knew that I liked teaching and talking and some more of those nursing interventions that are around education and talking with a patient rather than like stabbing with needles. Not really stabbing, but with needles and the medical interventions like that. I really liked the medical interventions that were more about talk and support and teaching, and so I think mental health was just kind of a natural piece of that it combines healthcare and those kind of interventions that I really like. It's really, I mean, it's challenging when people aren't getting better, and you kind of feel like, what are we missing here? We've tried a lot of the right medications and a lot of the right treatments, and that patient's working their butt off to feel better, and they're just still being beaten down by mental health symptoms. And I know scientifically, medically, like there has to be an answer there. And I am always there and going to show up for my patients to find out what it is, but it's really hard and challenging when I'm seeing them really start to lose hope that there might be an answer, even though I really believe there is, or even with myself, I start to question that when we just feel like we're just keep hitting wall after wall. That's really challenging. Well, of course, seeing people get better is huge, but just the relationships. I mean, I can't imagine doing anything else, or at least, not doing what I'm doing, at least in some capacity, because these patients are great. I mean, you get to a point when, you've been treating people for 8 to 10 years that you still keep good professional boundaries with people, but I mean, you don't even have to read their chart notes anymore. You just like, all right, well, what about, how's your dad doing with his cancer? Or how's how's this very specific symptom that we talk about every time in just a way that you and I talk about it? And I don't know, that kind of personal connection that you have with people, but it's still all about them and all about their mental health symptoms, but it becomes so personal and just kind of knowing that I get to play that role in somebody's life, like that just is really huge for me. Oh, so many things. I think we're starting to get there in terms of reducing stigma. And so I think that's really, especially here in the last couple of years, I mean, we always have setbacks, but I feel like we're just talking more and more, especially with the pandemic, like it just feels like it's becoming more accepted and, more okay to seek out mental health services. So that's one change that I think I see happening. The other is just the introduction of even more and more evidence-based and scientific approaches to mental health. Again, we have those, but instead of having money put towards just let's make these newer and newer psychiatric medications, though don't get me wrong, some of the newer medications are awesome. I mean, they can be more robust or use genetic pathways that are more accessible to more people, or improve on side effects. So that's great, but I think we need less of like new meds and more of what about other treatments or other type of meds or other, things like TMS, and how can we use that in different capacities? Like these things that we know have a scientific base. Let's not just do more of the same thing. Let's like broaden the scope using scientific approaches. How can we really look at our neurotransmitters and use that information to create more interventions and medications? And I think that's actually happening. I think it's right on the horizon. We're starting to see the start of that with things like TMS and pharmacogenetic testing and all of that. Yeah, I mean, I think I've already some of my biggest talking points with my patients are about hope, or about just knowing the bigger picture. I hear people, sometimes I've had people come in, and they've tried 1 or 2 medications and maybe therapy for 6 weeks, and they're losing hope. I mean, I never want to minimize someone's experience, and I don't want to minimize the pain and the sacrifice of not only the mental health symptoms that they're experiencing, but also maybe the hopelessness they feel, or how hard it is sometimes to get into this stuff and to really talk about it in therapy, and how hard it is to experience some of these side effects. So I don't want to minimize that, but I also want people to know that there's so much more than that, you know. And if you're on a medication and you're having weird side effects, like that's not a full picture of what we might be able to achieve. You know, that's not it. Like, let's talk about it. Let's talk about what other options there are, because there are so many. Hey guys, thanks for watching this video on our channel, Real Talk Mental Health, here in Vancouver, Washington. If you're struggling with mental health symptoms such as depression or an anxiety disorder, please reach out for help. And if you're in our area, in the Vancouver, Washington, or Portland, Oregon area, please reach out to us. We would love to hear from you. We'd love to help you. Thanks.